Hi, I'm Dr. Crystal Collier. Let's talk about alcohol and the brain. Only about 30% of the global population drinks alcohol, compared to 50% in the United States. Unfortunately, in our culture, alcohol use is sometimes seen as a rite of passage, especially for young people. That's why it's important to know that about 90% of adults who get diagnosed with an alcohol use disorder began drinking in their teens. In fact, the earlier a young person is when they start drinking, the greater their risk of growing up and struggling with a substance use disorder. But just delaying can be protective. Okay, but why does waiting to use alcohol until 21 or over almost completely eliminate the risk of growing up and struggling with an alcohol use disorder? Yep, it's all about brain development. Specifically, the adult part of the brain, the frontal lobe, which is not completely grown until about age 25. And it has everything to do with the brain's rule: use it or lose it. Alcohol shuts off the frontal lobe, which is really dangerous if we're in the first two phases of our brain's development, when we're growing our executive functioning skills, the skills we need to grow up and become a fully self supporting adult with good relationship skills. Okay, but exactly how does alcohol affect the brain during these critical growth stages? The brain scans on the top row show a person who has no alcohol or drugs in their system. Remember, we're looking at the brain from the top down. The bottom row shows brain scans of someone who has used substances. Notice how substance use shuts off the frontal lobe while keeping the limbic system, the survival part of the brain that feels pleasure, on. But if the frontal lobe is off while it's developing, does it get to grow? No, it doesn't get to develop normally as it should. This state of arrested development is called hypofrontality. So if someone starts abusing alcohol here at age 12 and does so regularly, their brain may not look like it should by the time they're 20. And if they keep abusing alcohol until age 25, their executive functioning skills may never get to fully develop. Check out these brain scans of two boys while they're doing a memory task. The color indicates brain activity. Our non-drinker has a lot more activity than the heavy drinker. But can you spot the more subtle difference? The structure is different. Our non-drinker has a lot more wrinkles and grooves in his brain, indicating those long networks of brain cells that are forming, but that's not happening as it should for our heavy drinker. His development is arrested due to alcohol consumption. So can you delay to let your brain grow to its fullest potential? Not sure? Here's some more information. Besides arresting frontal lobe development, underage drinkers may have lower thinking speed, memory problems, reduced attention, less impulse control, and lowered ability to process information than young people who do not drink alcohol. Part of the issue with underage drinkers is that they don't monitor their servings or serving sizes like adults. That means they engage in binge drinking. So it's important to know what that means. Alcohol is a toxin that depresses your central nervous system, your brain and spinal cord. So alcohol reduces your ability to think, coordinate movement, and accurately sense what's going on in your environment. Now, the human body can only handle about 1 to 2 serving sizes of alcohol before it becomes impaired. Unfortunately, many young people who drink fail to count their serving sizes and end up binging. That's why it's critical to memorize the responsible drinking formula, which states that people should use alcohol if they have no or a small genetic addiction risk, are 21 years of age or older, are in a safe environment with safe people, and have one serving size per hour, no more than 2 to 4 servings per day, depending upon their height and weight, and no more than 1 to 2 days per week. A lot of adults, even the ones who don't drink, ask me this question: doesn't everyone drink when they're young? The truth is, a lot of young people get curious but don't go on to drink. We call them the silent majority. In polls taken all over the US, the numbers are in. Most young people choose not to drink, and more are making that choice every year. It's also important to know that alcohol is a factor in all three leading causes of death for 15 to 24-year-olds. Drunk driving is the #1 cause of teenage deaths, and unfortunately, every 50 minutes someone dies in a drunk driving crash, and 1 out of every 4 of those crashes involves a teen driver. As you get older and start going to youth events, it's critical to spot alcohol overdose and know how to respond. If you suspect someone has alcohol poisoning and is overdosing, do not assume they'll sleep it off. Check for slow or irregular breathing. Call their name and shake them to wake them up. If they have pale or clammy skin or look like they're in a stupor, keep them sitting upright, leaning forward to prevent choking, and stay with them while you call 911 and wait for emergency medical help. Remember the use it or lose it rule. How will you protect your brain from alcohol, especially while it's growing and developing?